Hello everyone, welcome to Biotech Regime. The COVID-19 crisis is worsening with the eruption of various fungal infections in the corona patients. In my previous video, I had explained the much spreading black fungus. Recently, reports of another type of fungus, commonly being called as the white fungus, are coming from all over the globe. Let us understand what this white fungus is. But before that, let us become aware of the relation between COVID-19 and the fungal diseases. Symptoms of some fungal diseases can be similar to those of COVID-19, including fever, cough, and shortness of breath. Laboratory testing is necessary to determine if a person has a fungal infection or COVID-19. Some patients can have COVID-19 and a fungal infection at the same time. People with severe COVID-19, such as those in an intensive care unit, are particularly vulnerable to bacterial and fungal infections. The most common fungal infections in patients with COVID-19 include aspergillosis or invasive candidiasis. These fungal co-infections are reported with increasing frequency and can be associated with severe illness and death. Awareness of the possibility of fungal co-infection is essential to reduce delays in diagnosis and treatment in order to help prevent severe illness and death from these infections. Hence, let's first understand COVID-19 associated pulmonary aspergillosis, abbreviated as CAPA. It usually occurs in patients with severe COVID-19 like those on ventilators in intensive care units. Aspergillosis is a disease caused by a fungus Aspergillus, which is a common mold naturally found around us both indoors and outdoors. Most people breathe in Aspergillus spores every day without getting sick. However, people with weakened immune systems or lung diseases are at a higher risk of developing health problems due to Aspergillus. There are different types of aspergillosis. Some types are mild, but some of them are very serious. Testing for CAPA usually involves obtaining specimens from patients' lower respiratory tract, which are tested for Aspergillus galactomannan antigen and fungal culture. An important point to note here is that aspergillosis is not contagious and thus cannot be transmitted directly to other people. Another type of fungal infection, COVID-19 associated Candida auris infection, commonly being called as the white fungus, is an emerging serious global health threat because firstly it is a multi-drug resistant fungus. That means common antifungal medicines will not work on this fungus. Secondly, it is usually misdiagnosed, and most importantly, it causes outbreaks in healthcare facilities like hospitals. While fungus can affect not just the lungs but also other parts of the body, including nails, skin, mouth, stomach, kidney, brain, and private parts. In some patients, this yeast can enter the bloodstream and spread throughout the body, causing serious invasive infections. Patients who have been hospitalized in a healthcare facility for a long time have a central venous catheter or other lines or tubes entering their body appear to be at highest risk of infection with this yeast. So, who all are at risk for infection from Candida auris? People who have recently spent time in nursing homes and have lines and tubes that go through their body, such as breathing tubes, feeding tubes, central venous catheters, seem to be at the highest risk. Infections have been found in patients of all ages, from preterm infants to the elderly. Why is this fungus such a big threat? Well, because Candida auris is a drug-resistant fungus. It causes serious infections which may become invasive when the fungus would enter the bloodstream and would have access to the whole body. Now, this may be fatal. As it is resistant to many antifungal medicines, it would be difficult to treat. It spreads quickly, it is difficult to identify, and also this fungus finds home specially at places where sick patients are kept and spreads easily through contaminated surfaces or equipments. Let us see some ways to stop this deadly spread. Regular hand washing by all at the hospitals, use of clean gloves and gowns by the healthcare workers, and maintaining proper cleanliness and disinfection in the hospitals. Every individual, sick or healthy, should contribute in the prevention of spread of any infection in this global health crisis. The only weapon, but an effective one, is particularly good hand hygiene and maintaining personal as well as environmental cleanliness. Early detection and infection control can limit the spread of Candida auris, that is, the white fungus. Stay home, stay safe. Like and share this video if you found the information beneficial. To watch our latest video, subscribe the channel. Thank you.